Hi, Sydney. Welcome in today. I am going to be Dr. C, taking care of you for your dental exam.
Thank you.
Of course. I'm first going to ask you to verify your first name and your date of birth for the exam.
Sydney Smith. And my date of birth is May 10th.
Perfect. And what brings you into the dentist today, Sydney?
I'm on a new insurance that actually includes dental this time.
Perfect.
So it's been a few years since I've had a cleaning, so I figured I should come in and have one. Since it's been a few years, I guess I'm not really comfortable being in a dentist office anymore. So a little bit of anxiety there.
Yeah, I understand. I feel like a lot of people experience some anxiety around dental work. It's a pretty personal examination. So I'm glad that you voiced that with me, and I'm going to make sure to take extra gentle, good care of you today. So no need for any anxiety. All you have to do is focus on breathing and relaxing.
Thank you so much.
Of course. I am going to go ahead and fill out just a few questions before we get started. Do you take any medication at the moment?
Not daily. I occasionally take Advil or ibuprofen.
Gotcha. Do you have any allergies?
No.
Would you classify your teeth as being sensitive to just like general, do you have like high cold sensitivity or heat sensitivity?
Not to heat, but sometimes cold sensitivity, particularly ice cream.
Gotcha. Have you ever had a cavity before?
I've had a couple when I was a kid.
Okay. And can you remember when your last dentist visit was?
I think it was about 2 years ago.
Okay, perfect. Great. I'm going to go ahead and file this into your chart. I'm going to set this aside, and then we will begin with our exam.
That sounds great.
I'm going to go ahead and put on a mask here. This is upside down. Okay, perfect. First, I'm just going to make sure that you're generally healthy before we do our exam. I am going to take your temperature here. Just gently moving your bangs so we can get an accurate reading. Perfect. 98.2. Perfect temperature. I'm going to set this aside. And I'm going to check your oxygenation levels. Just going to gently grab your finger here and put it inside the device. Go ahead and relax. Just to make sure that the temperature reading was accurate as well. I do have one more mouth filler. I'm just putting a protective shield on it. Plastic shield around this. I'm going to ask you to open your mouth and stick this under the tongue. Perfect. And give that just a second. What's happening? Go ahead and put on some gloves. Celsius. Good. I'm going to remove this and set this aside. Now I'm going to go ahead and just take a look at the outside of the jaw structure as well. A lot of people don't really think about teeth affecting the greater jaw area, but it really is all connected. So I just want to do some gentle palpations of the face. Just really gently rolling my fingers over the skin, feeling the muscles underneath, feeling the lymph nodes. Gently feeling along the jaw, down along the lymph nodes. I know you mentioned having some anxiety, so I want to give a nice gentle reminder that all you need to do during this exam is focus on breathing and staying relaxed and comfortable. I'm not feeling any swelling on the face, which is a good sign. Lymph nodes are nice normal size. No abrasions or bruising on the skin, which could indicate a more serious issue. Making sure to be very thorough and gentle. The jaw has a nice, good structure to it, even on both sides. Now we're going to move on to the actual dental procedure. To start off with, I do have some Listerine, Cool Mint, alcohol-free. I'm going to have you rinse your mouth with this before we start. The cap can be a bit tricky to get off sometimes, so I'm just going to gently press down and twist. There we go. Adding just a little bit. Of that Listerine. It can be a bit of a strong taste by itself, so I'm going to water it down just a bit. Great. I'm going to ask you to sit up a little bit to have some of this. You can swish it around in your mouth. Perfect. And spit it up in this cup. Perfect. Great. And close here. Tapping gently at the jaw. Great. You have a selection of tools here. I'm going to grab the mirror. And I'm going to grab this dull tool here for the first general inspection of the teeth. Okay. Good. I'm going to have you open up your mouth indications are that they're looking really, really nice. I'm going to grab a light, just to help me look a little bit more deeply. Good. Nice color to the teeth. Looks like we do daily brushing. I can see the fillings that you mentioned. They're looking healthy. No signs of any decay, no signs of anything to be concerned about. Structure and sound. Moving on to the second tooth on the right. Gently switching hands here. Good. Moving on to the third tooth on the right side. Looking at the third tooth. Good structural integrity. Moving on to the fourth tooth on the right side of the upper jaw. And continuing down to the fifth tooth. Good structure. And we're getting really back there. And last but not least, the final tooth. Okay, good. Now I'm going to gently move on to the other side, looking at the second tooth and the first tooth on the upper left side. Good. Moving back slowly into the left side of the upper jaw. All teeth are feeling structurally sound. Good. I'm going to give you a second to swallow. Take a few breaths. I know it can be a little bit of work holding the mouth open for that long, so I'm just going to give you a minute. And while that's happening, I'm just going to take a look at your oxygenation levels. Perfect. I'm just going to go ahead and keep this on you during the exam, just so I can take a look, see if the heart rate is ever raised or if there's ever any needs for concern. How are you feeling so far? Are you comfortable with everything that we're doing here?
I am feeling comfortable. Thank you so much for taking such good care of me.
Of course. I'm glad that you're feeling relaxed. We are going to go ahead and move on to the lower teeth. I'm going to ask you to open your mouth, and I'm just going to gently slide this mirror down, looking at the bottom teeth. Perfect. Everything's looking healthy and structurally sound. teeth in the back. And gently tap. And the very back molar here. Great. All the teeth are looking and sounding nice and sound. Good. Okay, great. Everything is looking really lovely. It's really clear that you take really good care of your teeth. We are going to go ahead and move on to the cleaning part. I don't see any cavities, which is a great sign, so nothing to worry about there. Just going to pull free one of my other tools. Alright, I'm just going to do a light cleaning around the edges of the teeth with this little sharper tool here. It is a bit sharp, so just make sure you hold your head still and I make sure not to accidentally poke you. Let's start with the bottom teeth first. the top teeth. Go ahead and just continue to relax. The teeth are looking nice and healthy. I do want to go ahead and just take 2 samples though of the teeth just to make sure there's no hidden bacteria I can't see. Good, it's going to open up your mouth. Great. I'm just going to gently glide the sponge over the teeth. Have you rinse again. I'm just going to make sure that you have another little stream of water. Go ahead and lean forward a little bit. Go ahead and swirl that around. Perfect. I'm gonna set this one aside. Flossing. I'm going to make sure to be nice and gentle with this. I'm going to have you open your mouth, and I'm just going to really gently slide this flosser in there. This one aside. It's another one. Just really gently moving this between the teeth. stick out your tongue and say, ah. Good. Gums are nice and pink and healthy. Tongue looks healthy. Taste buds are looking healthy. I'm going to have you stick your tongue to the roof of your mouth. Good. Tongue underside is nice and healthy. Perfect coloration. Now I'm just going to go ahead and stick this in to look at the cheeks. Perfect. The other side as well. Perfect. Now the last part of our cleaning is going to be with some toothpaste and a brush. I have this Crest 3D whitening. I'm going to gently squeeze this into the tube, and I have this tool. And then I have this toothbrush. I'm going to wet it just a bit. I'm going to come back to the mirror tool. I'm going to have you open your mouth for me. Great. Reach in and slowly begin to brush the teeth and the gums both with this fresh toothbrush. I'm sorry. Stick this in here so we can more accurately see the sides of the teeth. Making sure to get all sides of the tooth. test around the mouth area. You mentioned a little bit of sensitivity to coldness, so I just want to do a general test in the area of the mouth, of warm or cold. If you close your eyes, this is what warm is going to feel like, and this is what cold is going to feel like. Do you notice a difference between those two sensations?
Yes.
Good. Go ahead and tell me if this is warm or cold.
Warm. Warm. Cold. 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 Warm. Warm. Cold. Cold. Warm. Warm. Cold.
Good.
Cold. Warm. Cold. Cold. Warm. 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 Cold. Warm. Cold. Cold.
Good. We're going to do one more similar test with either sharp or dull. This is what sharp is going to feel like, and this is what dull is going to feel like. Do you notice a difference between those two sensations?
Yes. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull.
Okay, perfect. All right, Sydney, I'm going to have you open your eyes and kind of readjust to the settings here. I did go ahead and complete your exam. Your teeth are looking lovely, so I'm super happy that you came in for a checkup. We went ahead and we cleaned, we flossed, so you should be feeling extra refreshed and have your teeth feel nice and rejuvenated. How are you feeling? Is your anxiety a little bit better about today's session?
Much better. Thank you so much. And I feel nice and squeaky clean.
Yeah, that is the goal. I had such a great time taking care of you, and I will see you again in 6 months.
Bye-bye.
Bye-bye.